right now in my own congressional district, we have 147,000 people in my own district with no health care insurance. The issue is that even if you had any other kind of industry, imagine, any other business, in which they were losing 14,600 customers every day, you think they'd be very upset and concerned. You think they'd be moving forward to try to get something to stop this damage, this loss, this erosion. But no, the insurance companies are fighting against that. So we must understand, come together on those things that we have in common. And that is the high cost of health care insurance, and then move to fix it. We will have that exchange. And now much has been made of what we call the public option. Let me explain to you quickly that the public option is not there to be a stepchild or a stepping stone to moving the government to take away and to control health care. Nothing could be further from the truth. We want people to have choices, and we want the prices to come down. The public option is put into the exchange to bring about competition. Bring about competition for the other insurance companies so that the prices can come down. And secondly, to serve as a place where people who don't have insurance can go to get insurance. We have businesses, small businesses especially, that no longer provide insurance because it's too high. And they're going out of business because of healthcare insurance. But there's one thing I found out with the automobile industry when we were trying to help them. The biggest cost of making the car wasn't the bolts, it wasn't steel, it wasn't anything going into the car, it was the health insurance because it's so high. So we want to bring that down. There's some areas that I want to bring to the table to help with that as well that's not there. And that is the high cost of medical liability insurance. I happen to believe that it's a mistake not to put that on the table as well. Because one of the primary reasons and primary problems we've got is a shortage of doctors. And the number one reason that young people use for not going into medicine now is a high cost of medical liability insurance. The doctors are leaving the profession because of the high cost of medical liability insurance. You get out of school, you go through all of that, and the internship and the 8 years of training that you must go, and then you're faced with your own bills of how you to pay to get through medical school. And then when you get out, you got to get $100,000, $150,000, $200,000 in insurance to go forward. Tort reform must be at the table. One of the other reasons it causes doctors to have defensive medicine. You go to the doctors, they send you through a series of tests that perhaps you don't need, but they do it to protect themselves. And so for all of these reasons, the cost, the defensive medicine, the help with the shortage of doctors to get more in, tort reform, medical liability should be at the table as well. It's not there now. So I want you to know going forward that this is a work in progress. And we're open. These forums are very important. I've not shied away from them, and I've had several, and will continue to do so. And let me assure you that what you say to me today, I will take into me. Because in the final analysis, the only way this will work is that we bring the American people along with us. And we can do it, and we must do it. Thank you very much.
Thank you, Congressman Scott. Before we go any further, I would really like to acknowledge your state representative. Please give a warm welcome to Alicia Thomas Morgan. All right, now it's time for community conversation, question and answer session with Congressman Scott, of course, Mrs. Nora Super, and Dr. Joyce Payne. So before we get into that, as you enter the venue today, those of you who indicated that you really wanted to ask a question, you were given index cards, like these, yellow, pink, blue. I will call for questions according to card color. Once your color is called, proceed to the microphone in the center of the aisle. You have 2 minutes to ask your question. We'll have an hour and 20 minutes for questions today, and if there's time, we'll take additional questions after the question and answer session. For those of you who do not get the opportunity to ask your question, please write your question at the bottom of the green form that you were given when you came in, and we will try to get those answers to you. Now let's have the yellow cards to take the microphone in the center aisle, please.
They gave white cards as well.
Oh, white card. Well, I was just mentioning a few of the colors, but we have, let's see here, white, blue, pink, yellow, but now we'll take the yellow cards in the center aisle, please.
Not in a wheelchair.
Okay, well, we'll get a microphone over to you.
Yellow cards.
Yellow cards, please.
All right, good morning. My name is George Davis. I'm a retired teacher, and I'm anticipating in a few years being on Medicare. I have Kaiser Permanente insurance, which I'm very pleased with now. I think it's instructive that it appears most people on Medicare are pleased with their insurance. And I also think it's instructive that as I look around this room, we have a lot of people who are either on Medicare or soon will be, and probably have at least relatives who either have been or will be. And I found out something interesting the other day, that we need to be aware that for every dollar we've put into the Medicare system, those of us who were born after 1944, we're going to be getting back $3 on the average in benefits. Now, where's that $3 coming from? Some of it we already put in. Some of it was earned through interest and so forth in the fund. But there's a lot of it coming out of our children and our young people. And I know there are a lot of people who are saying we shouldn't be putting this on the backs of our children by taking on greater debt. The fact is, we're putting it back on the backs of our children by just being here and existing. Therefore, I think it's very important that we consider Medicare for all, so that our children who are going to pay for this for us are kept healthy, and they can work hard, and they can provide more to our economy in a more efficient way, so that we then are able to take advantage of this privilege that we have of being able to be supported by a government program. So therefore, I'm in support of Medicare for all, and in lieu of that, because I know there's realities here, we at least should have a single payer, or not a single payer, but at least a public option available in the final bill that's passed. And we in AARP should be supporting public health for all of our youth, as well as those 50 and above, because we're all going to benefit from it in the long run. Thank you.
Congressman Scott.
Sure. I certainly concur with you on the public option. As far as the Medicare for all with in the single payer, let me just try to respond to that. Our infrastructure and our unfortunate modest supply of physicians basically negates that move. If you look at several of the places, Canada and other places that have embraced more of a universal type care, you find waits tremendously long. And so the practicality of the matter is that the public option gets us to where we want to get. For example, under the plan that we're working together with President Obama on, 98% of all Americans would be covered once we pass this plan. And in a way, I think that the public option provides us with what I really think most Americans need, and that is a choice. There'll be some who would like to have Medicare, but there are others who say, look, I want my own physician, I want my own insurance, I want this. And we've got to maintain the freedom of choice for individuals to do that. The public option that you mentioned is so vital, and it's been so maligned. that I want to take a minute, if I could, just to explain that.